Infection control nurses are healthcare professionals specialized in preventing and managing the spread of infectious disease within healthcare settings. One of the primary responsibilities of infection control nurses is surveillance. They are the watchdogs for healthcare associated infections. Their role involves continuously monitoring and collecting data on infections within healthcare facility. This data helps them identify trends, potential outbreaks, and track infection rates over time, which is critical for making informed decisions. Infection control nurses are also educators. They take on the vital task of ensuring the healthcare personnel, from doctors to support staff, are well informed about infection control practices. This includes proper hand hygiene, the correct use of personal protective equipment, and the latest guidelines of preventing the spread of infections. These professionals play an important role in policy development. They work with healthcare institutions to create and maintain infection control policies and procedures. These policies must be meticulously crafted to ensure the highest standards of infection prevention and compliance with the local and national guidelines. Infection control nurses are risk assessors. They evaluate the risk of infection transmission in various healthcare settings. This includes analyzing patient populations, medical procedures, and even the design of the healthcare facility itself. Their goal is to identify potential sources of infection and mitigate those risks effectively. In the event of an outbreak or an unusual increase in infections, infection control nurses are the first responders, investigating the cause and implementing control measures to contain the outbreak, preventing further spread. They provide guidance in isolation and quarantine procedures. Compliance and auditing. Their roles include ensuring compliance with infection control policies and regulations. Infection control nurses regularly audit healthcare practices, acting as quality assurance professionals. So we are wondering where these nurses mainly work and what type of populations they serve. Well, the first population group I'm going to mention are the hospital patients. They often have compromised immune systems due to the underlying medical conditions, surgical procedures, or the use of immunosuppressive medications. They are at high risk of acquiring healthcare associated infections. Residents in long-term care facilities, such as nursing homes, are frequently elderly and may have multiple chronic health conditions. This population is susceptible to infections due to age-related weakening of immune system and close living quarters, making it necessary for infection prevention nurses to focus on this demographic. Newborns and infants have developing immune systems, rendering them highly vulnerable to infections. Infection prevention nurses working in neonatal intensive care units and pediatric wards play a critical role in preventing infections among this delicate population. Lastly, are healthcare workers. Infection prevention nurses are responsible for safeguarding the well-being of their fellow healthcare workers, emphasizing the critical need for rigorous infection control measures to mitigate the risk of occupational exposure to infection disease. Going back, infection control in nursing has a rich and evolving history that underscores the essential role of nurses in safeguarding patient well-being. Throughout the centuries, nurses have been at the forefront of healthcare, facing the challenges of infectious disease and adapting their practices to protect both patients and themselves. Florence Nightingale during the Crimean War is often credited as a pioneer in modern nursing and infection control. During the war, she and her team implemented rigorous hygiene and sanitation practices, which dramatically reduced mortality rates among wounded soldiers. Nightingale emphasized hand washing, proper waste disposal, and well-ventilated spaces, laying the foundation of modern infection control practices. In the mid-19th century marked a breakthrough with the germ theory of disease. Scientists like Louis Pasteur and Robert Koch introduced the idea that microorganisms were responsible for infections, triggered nurses to adapt to this new understanding with a focus on pathogen transmission prevention. Development of aseptic techniques in the late 19th century. Joseph Lister's introductions of aseptic techniques, like sterilizing surgical instruments and maintaining clean environments, greatly reduced infection risk during surgical procedures. The influenza pandemic of 1918 highlighted the need for infection control measures on a global scale, implementing isolation procedures and advocating for prevention measures such as mask wearing and hand hygiene. As of now, infection control nurses continue to play a huge role in healthcare settings, and their importance has been further highlighted by the ongoing COVID-19 pandemic. Regarding COVID-19 pandemic, Alaska's infection control nurses face a substantial challenge in managing COVID-19 due to the state's vast and remote geography. The expansive and often inaccessible terrain makes it difficult to efficiently distribute essential resources such as PPE, testing kits, and medical supplies to remote communities. On the other hand, the challenges faced by infection control nurses in Alaska present a unique set of difficulties compared to the rest of the United States. Alaska's vast and remote landscape, coupled with its harsh climate, creates logistic obstacles that are unparalleled in many other states. While rural and remote areas exist throughout the U.S., Alaska's extreme conditions amplify the difficulty of resource distribution and healthcare accessibility. In more densely populated states, transportation infrastructures may be better established, allowing for more efficient deployment of resources. Through the commitment of infection control and healthcare, there are some promising prevention programs created in Alaska, such as the Alaska Infection Control and Prevention Advisory Council, AKICPAC, was established in 2009. They are established to provide guidance and expertise, recommendations on strategies to facilitate the coordinations of efforts to prevent healthcare-associated infections throughout the state of Alaska. Second, Alaska Antimicrobial Stewardship Collaborative, A2SC, an organization committed to ensure that every patient in Alaska receives the appropriate antibiotic treatments at the right moment while minimizing unnecessary use. While the rest of the United States also had some very promising programs that were established, such as the Centers for Disease Control and Prevention, also known as the CDC, is a federal agency in the United States responsible for promoting and protecting public health. One of its critical roles is establishing national policies, guidelines, and best practices for healthcare-associated infection control. Other programs would be the National Healthcare Safety Network, NHSN, is a critical component of infection control efforts in healthcare settings. It provides a platform for healthcare facilities to monitor and report healthcare-associated infections, track trends, and analyze data to identify outbreaks and areas for improvements. Primary prevention aims to stop infections from occurring. Infection control nurses contribute through educating staff, patients, and visitors on infection prevention measures, overseeing vaccination programs to reduce vaccine-preventable diseases, ensuring strict sanitations and sterilization protocols to reduce contamination. Secondary prevention involves early detection and intervention. Infection control nurses participates through monitoring infection rates to detect outbreaks, identifying high-risk individuals for specific infections, implementing isolation protocols to contain infectious patients, and identifying exposed individuals and providing guidance. Tertiary prevention aims to minimize the impact of infections on already infected individuals. Infection control nurses contribute through ensuring infected patients receive appropriate care, developing specialized control measures for recurrent or drug-resistant infections, and providing education and support to infected individuals and their families.